My name is Janvier Miranda of Southwestern CDPHN, and welcome all to the meeting about Provider Connect Australia and the better and faster access to health information. The aim is to have a timely access to pathology results is critical for safe, coordinated patient care. In New South Wales, the better and faster access to the sharing of pathology results initiative is improving how pathology information is shared across the healthcare system, reducing delays, duplication, and information gaps between providers. This webinar will explore how pathology sharing is evolving in New South Wales and what it means for general practice, alongside the role of Provider Connect Australia in strengthening secure digital connections between practices and pathology providers. Designed for general practice teams, this session will focus on practical implementation, understanding new pathology sharing arrangements using PCA to maintain accurate digital endpoints, and embedding these changes into everyday workflows to support continuity of care, clinical decision-making, and practice efficiency. Some of the learning outcomes we aim to do is to explain the purpose of the New South Wales Better and Faster Access to Pathology initiative and its importance for patient safety and continuity of care. Describe the role of Provider Connect Australia, or PCA, in enabling secure, standardized digital connections between general practices and pathology providers. Identify how PCA supports general practice workflows, including referrals, secure messaging, and reliable delivery of pathology results. Apply practical strategies to integrate improved pathology sharing and PCA into everyday practice workflows, reducing administrative burden, minimizing missed or delayed results, and improving patient outcomes. I'd like to begin by acknowledging the traditional custodians of the land on which we meet today. I would like to pay my respects to the elders past, present, and extend that respect to those in the meeting who identify as First Nation people and/or Torres Strait Islander. Wendy O'Meara has 25 years experience in general practice. She has worked for the past 15 years as a full-time practice manager in a 24-doctor general practice in Gisborne, Victoria. Wendy has worked in all aspects of general practice, including reception, practice nursing, and practice management, and has a strong comprehensive understanding of all facets surrounding each area. She currently manages 15 reception or admin staff, 5 chronic disease nurses, and 8 GPs and medical students. She is responsible for IT, daily operations, and induction and mentoring of new GPs, as well as the students. She also prepares the practice for the 3-yearly accreditation cycle, having received the AGPAL Rural Award for Excellence in General Practice in 2019. Wendy thoroughly enjoys working with other practice managers and GPs to share her knowledge, particularly around MBS education and all facets of general practice, and has been delivering education sessions since 2017. I'll hand over now to Wendy O'Meara.
Initiatives. It's great to see so many here, and I look forward to sharing with you an overview of both initiatives, but also would like to talk to you a little bit about the benefits of these digital health programs and how they have the potential within your practice to help you to provide optimal care for your patients, but also save much needed time in our day-to-day working. So having said that, we're going to get started. Now, I'm going to just jump over the learning objectives because Janvier has kindly already outlaid those to you, so that's going to save us a few moments. You will get a copy of this presentation in PDF format, so please, you don't need to worry about writing things down because you will get a copy of this after today's workshop. So we're going to start off with better and faster access. As Janvier said, it's a relatively new program which is rolled out. What is it? It's basically a program rolled out via the Australian Digital Health Agency with the aim of providing access to, or faster access to information to both patients and practitioners via the patient's My Health record. In the past, there has been no requirement to upload key information such as pathology and radiology, leaving us often with gaps in valuable information, which then results in the potential to hinder our patients' care. The new sharing by default legislation introduced as part of the Medicare Task Force review aims to reduce this gap and give both providers and patients more access to their information. The bill passed in Parliament states that in order for pathology or radiology services to claim Medicare items, they must share by default. This is currently in the transitioning stage. So I want you to understand it's not mandated yet. So we are going through a transition stage where we're getting pathology and radiology on board. However, it's believed to be legally enforceable as of the 1st of July 2026. So we've still got a few months to get our pathology companies up to scratch with that sharing of information. I'm not sure about you, but I have already seen a much bigger volume of sharing, patients ringing and saying, I've got my results in my health record before we've even seen them. So it is there, it is working, but we really need to understand how it's going to impact our business. So as part of the broader program, the New South Wales Better and Faster Access to Pathology initiative is again aims to improve how pathology results are shared with both patients and healthcare providers, making them more complete, more timely, and easier to access through the digital health system, especially My Health Record. How does it work in your practice? Basically, the initiative promotes the use of financially supported tools such as Provider Connect, which we're going to talk about later, to keep practice and provider details synchronized across pathology labs, secure messaging providers and services, reducing failed deliveries or mismatched addresses. So we've all seen that we get pathology results that don't belong to us, or we don't get pathology results that we're waiting for. So this aim is to actually improve that for us. So from mid-October 2025, most pathology results were available to consumers to view in their My Health record or their My Health app immediately after they were uploaded. Prior to that, a 7-day delay was in place with exceptions for specific tests. So things like COVID-19, respiratory infections, INR, and any kind of diabetes monitoring was always available fairly quickly, but there was usually a 7-day delay in any other results. And for certain categories such as anatomical pathology, cytopathology, or genetic testing, there is still going to be a delay, but it will be reduced from 7 days to 5 days, regardless of the test outcome, obviously allowing treating clinicians or GPs to review the tests before the patient sees them. So that's a good thing, I think, because some of these tests can be misinterpreted. So immediate upload for most pathology with the exception of the bottom category, which will be available after 5 days instead of 7. Here's a list of the new test categories, what's going to be available for us as soon as they're uploaded for both ourselves and our patients. So it gives you a bit of an idea. I won't spend a lot of time on this, but as you can see, there's a huge range of tests that are now going to be available as soon as they are uploaded for our patients to view and also for us to view. So it's important to note there is no change to the timing for access for treating clinicians. Reports will continue to be available as soon as they're uploaded. So there's been no change for us. Subsequent changes for diagnostic imaging reports, which have occurred, so they're sort of March 2026, this is now happening, with reports for things like x-rays of limbs to be available immediately, and the delay for other reports again to reduce from 7 to 5 days. So patients will also be able to see imaging results. They will not be able to see the actual images. They will only be able to see the report. But again, great for us as well, particularly if we are not the referring clinician and the patient presents to us for results. So again, it's going to be fantastic. I'm really excited about this. Of course, there are going to be exceptions to the uploading process. Under the legislation, there are certain circumstances when information does not need to be uploaded to My Health Record by default, because one of the following exceptions may occur. The patient requests that the information not be uploaded. So remember, My Health Record is patient driven. So if the patient does not want their results uploaded, they have the right to say, I don't want to upload. So we need to make sure we tick that box in our pathology form that says, do not upload to My Health Record. I'm sure you're familiar with it, but if you're not, next time you look at your pathology form, make sure that that box is tickable so that they're not going to be uploaded when the patient has requested they don't be. The other thing is it could be a carer or a representative, could be a parent that says, I don't want this information uploaded. It could be a 17-year-old child that's having sensitive testing and doesn't want it uploaded where their mum or dad may still have access. So we need to keep that in mind as well. Also, things like unplanned system outages. So your internet goes down or there's glitches with the My Health Record and for some reason you just can't upload it. That is classed as an exception, I should say. And finally, probably an important factor to consider, you as a treating health practitioner may believe that the information should not be uploaded because of the serious concern of the patient's health, well-being or safety. So sometimes results that you feel could be detrimental to the patient should probably not be uploaded. And as a treating clinician, you have the right to make that decision. So what does this mean for us in general practice? The top one is the thing that resonates with me most is fewer lost or misdirected results. And being able to view the pathology or radiology in a patient's My Health Record, regardless of whether you referred them or someone else. Now, we all know what that's like. Patients come to see us, they've had blood tests, they were ordered by someone else. We weren't copied into it, so we have no results. So we're therefore wasting time chasing pathology companies or chasing specialists or phoning hospitals, and it delays the care that we can give to that patient. So this is going to be a fantastic initiative for us in general practice, and I'm sure you agree that this is very frustrating, and hopefully that will be addressed with this. So that's going to reduce time. And remember, we are so busy in general practice. The more time we can drag back for ourselves, the better. So not having to chase results for either ourselves or our staff is going to be a big time saver. We also need to consider the audit trail for accreditation. So accreditations state that we must show how we have timely access to patients' results. So we can show that we have, the way of actually viewing results as soon as they're uploaded, regardless of the referrer, is going to be a tick against our audit trail for accreditation. But it does require some practice management software configuration. So you need to make sure that your software is conformant, that you have My Health Record access and that it's enabled, that you have valid HPIO and HPII or organisation and individual HI numbers to ensure that digital conversation takes place, and then you also have a current NASH certificate installed. If you are e-prescribing or uploading share health summaries or doing anything, you are already compliant. So if you're thinking, am I or aren't I? The answer to that is yes, if you are doing any of the things I just mentioned. But if you're not, these are the tips or the things that you need to know to ensure that you'll be able to make the most of this program. So again, greater visibility of patients' results ordered elsewhere. So I did touch on that briefly, but the most frustrating thing I think as a GP or a treating clinician is when patients, as I said, arrive and they have had tests ordered from a specialist. Now, we don't want to repeat the process, but we need those results. We can't action or work with those patients without access to those results. So having them available at the touch of a finger, a couple of clicks of a button is going to be fantastic. Also, if they've been to emergency departments or they've been traveling interstate, and often patients don't know where they had that blood test done. What pathology provider did you go to? Can't remember. So that makes it even more frustrating. So therefore, that results in fewer unknown investigations during a new patient visit. So another really key point is when you get a new patient to your clinic, you have no history. You have nothing that tells you. And until you can get that history from their previous practice, it's going to put you at risk if you don't know that patient's history. So important things that can be available through the patient's My Health record. And I wonder how many of you actually do that. Every time you get a new patient, go into that patient's My Health record and look for previous blood tests or discharge summaries or any other communication. And I will show you a little bit later how you do that if you're not familiar. I work with best practice, so I can only show you the best practice settings, but I can certainly, I'm sure that most clinical software are very similar. The other thing that's really important is improved medication safety. So when patients have abnormal results, such things as EGFR or potassium, or their INRs are out, or their liver functions are out, they're adjusted, they're visible to you straight away, so you can then adjust their medication immediately or remove any contraindicated medications that can be avoided, which is going to result in much, better medication control of our patients or safer medication control for our patients. So safer prescribing, so gives us better outcomes for our patients with chronic disease and that stronger continuity of care because we can pick up where someone else left off when it comes to results. So it's particularly relevant for patients who may be transient or mobile and go between multiple practices. So as a treating GP, it's very difficult, isn't it, when you're seeing someone that someone else has been looking after to get that big picture. Another key factor, of course, is the reduction of duplication of testings. Often we don't have access to previous results. And in order for you to actually aid diagnosis, sometimes we need to order pathology tests. And if they've already been done, it's basically duplication, which, is inconvenient for you and for the patient. It can add time to the patient's consult. It can delay treatment. And it can be, as I said, inconvenient when the patient has to return to have a blood test if, for example, it's a fasting one and they haven't been fasting when they see you. So again, having those results quickly ensures appropriate prescribing. So an example would be a patient with a UTI that is currently being treated with the wrong antibiotics. We see that all the time. The UTI is diagnosed, a broad spectrum antibiotic is prescribed. However, pathology comes back saying that, that this bug is resistant to certain antibiotics, and we then have to change the medication for our patients. So having access to that quickly will allow us to ensure that the patient is on the most appropriate treatment. And as you know, we work in a multidisciplinary team. We are part of the bigger picture. So we as GPs work collaboratively with specialists, hospitals, allied health. So again, this is going to give those providers access as well. So specialists will be able to see what they've been ordering and they'll be able to see what we've been ordering. We'll be able to see information from hospitals quickly and timely, which they are getting better. I'm not sure how New South Wales works, but Victoria has certainly stepped up its game with discharge summaries being available really quickly. By doing this, it does enforce that stronger collaborative care. We all know where we're at. We know what's been done and where we're at with everything. And with particular focus, I guess, on improving discharge follow-up. So patients are discharged with recommendations. If there's a delay in receiving that discharge summary due to, for example, incorrect information, and that's where Provider Connect comes in, and we're going to touch on that and how it's so important to ensure that your information of your business is correct. which gives our patients a smoother transition between hospital and back into our community-based care. Particularly relevant for aged care patients who have got poor recollection, what was done in hospital, what the outcomes were, what the recommendations were after they were discharged, and of course, chronic disease and those patients in aged care homes. So the aged care facilities that we may be looking after, sometimes the information goes back to them. We don't get it, so we don't follow our patients up. So obviously, all of this is going to make a huge impact on how we can look after our patients. Now, the one thing I do really want to, I guess, address when I was writing this presentation, my first concern was, okay, if patients can see their results, what's stopping them from diagnosing themselves or worrying unnecessarily? So I think it's important that if we are going to engage or encourage our patients to view their information or that they're aware of it, that they must understand what the impact is and the importance of following up with their GP. So you should be mindful that patients may choose to look up their own results. I have children, and all three of them already know what the results are before the test the doctor has looked at them. So they're all really, and the younger generation is very IT savvy. So any kind of service that's available, they know how to access it. And in many cases, patients have reviewed the results before they return to a follow-up appointment, or they might say, oh, no, my results look okay. I'm not going to go back. I'm going to cancel my review appointment. So this is probably a concern for me, but I also thought about, all right, how am I going to turn this around and make this work for my practice? So I've spoken to my GPs about that conversation, having that conversation with their patients before ordering a test. So, explain to the patient that these tests, are quite complex, and there may be unexpected or sensitive results. So please ensure you follow up with me to get those results so that, because often tests, when you're looking at blood tests, there's all these, short LFTs and EFR and things that mean nothing to a patient. And then they start Googling it, it becomes really tricky. So where appropriate, explain to the patient that the results will likely appear in the MyHealth record shortly after their test or scan has been performed, and let them know what to expect, including that some results may be difficult to interpret without context or resources, and that they shouldn't be using Dr. Google. They should actually be coming back to you, the referring practitioner, if they have any questions. Explain that the follow-up consultation is the best way for them to understand their results and to provide context based on the patient's own medical history. So, for example, a patient may have an abnormal test, marked in red as being abnormal, yet it's completely normal for them. So often patients don't understand what, HDL, LDL is, or what EGFR is, or what LFT is. So when they see that those levels are high or low, they're concerned because they don't understand how it impacts on their personal medical history. So reassuring patients that not all abnormal results are a cause for alarm, and that you as the healthcare provider will continue to contact them directly if urgent action is required. So that's important, that we continue our recall or reminder process for any urgent action or any, abnormal results, just like we normally would, regardless of whether we know the patient's seen those or not. So how do we see? I've just told you what there is available in our MyHealth record. How do you see it? If you don't know, this is just a couple of quick screenshots of my system to show you how you will see patients' results in MyHealth record if you don't know. So obviously, when you're in your patient file, you can either navigate to the top toolbars where it has the MyHealth record, or you can click on the MyHealth record, which has got that red, which I'll just circle around here. It's got that red square around it. And you would then click on View Document List, which is the first tab under the MyHealth record list. What then appears after a little communication with the MyHealth record is a list condensed into specific types. So as you can see, I have highlighted pathology overview. There are filters on the left-hand side. My left, it could be your right, where you can set date range if you're looking for something older than 12 months, because it defaults naturally to a 12-month period. What's also interesting for those who don't know, the second line from the bottom, My Medicare Registered Practice. Now, I know it's completely off point, but I get so many GPs or practice managers asking, how do I prevent rejections of 965s for my patients who are registered elsewhere? You can quickly find out whether they're registered by clicking on that button. It will tell you where they're registered, if they're registered. So if there's nothing in there, they're not registered. If your clinic's name's in there, they're registered with you. But if another clinic's name is listed, they are registered elsewhere. So just keep that one in mind. But you can also see there is pathology overview, diagnostic imaging overview. There's Medicare for provision of services over the last 12 months. And of course, any shared health summaries that have been uploaded, along with immunisations and the patient's history, medical conditions. So a really good resource, and anything that you can access through the My Health record, you can download into the patient's file. So if you're looking for something, that you, instead of having to print it, you can actually save it directly into your patient's file. So really valuable tip if you don't know how to find this. I'm sure most of you do, but I'm just touching on that maybe 1% that's attending today that doesn't know. So that is how you will find that information, and the information hopefully will just continue to grow as time goes by. So while the changes to the faster uploading of results is advantageous to all of us, we still need to focus on ensuring that the information about both our practice and our practitioners is current and shared appropriately to our business partners. And registering your practice with Provider Connect Australia will ensure your information is both those things, current, factual, and accurate, to ensure the timely exchange of clinical information. So we're now going to look at, both of these programs really do work side by side, hand in hand. Using one without the other or using them both together is the optimum way of ensuring that we receive all those pathology results that I've just talked about promptly and efficiently. So let's now look at how Provider Connect, if you're not aware of it, can help. Now, I'm not going to go through a huge spiel on what it is and how to register. There's lots and lots and lots of information available to you. Contact your digital health team at the PHN. They'll be able to certainly support you through the registration process. But there's lots and lots of information available to you as a treating practitioner or as a business online. So Digital Health Agency has some great little short webinars. So worth touching base with those. So my focus or my lens today is on how it can assist you. What are the benefits to you? Because when I write a presentation and when I prepare to present, I always look at what would my GPs want to know? How would I get them engaged? So the first thing I would do is explain to them what it actually is. So it's basically a core central platform that allows healthcare providers to maintain a single trusted set of information about the following things: their organisation, and that can include things like practice contact details, delivery service locations, so where you are actually located, do you have multiple sites, your practitioner details, who is working at your practice, your GPs, your allied health, anyone that works from your practice. By sharing that information and ensuring it's accurate is going to certainly help with all the issues we talked about before around chasing, discharge summaries that went somewhere else, or pathology results that didn't come to us because our details were not up to date with that particular pathology provider. and of course, what healthcare services we provide. So, we provide immunizations and we provide medical aviation checks and we provide spirometry and all those kind of things. All the services that would attract patients to your clinic are then shared with your business partners who therefore the consumers can actually access that information. And you can select whether the information is shared automatically across your business partners. And we'll talk about what business partners are in a moment, in case you're thinking, who are my business partners? Or you can actually manually do that. So that's important to know too. You can control what is pushed out to other providers. So looking at this, I have borrowed from the Digital Health Agency a couple of slides, which I think sometimes, if you're a visual person, this is going to work probably better for you. Your business partners can include many of the following. The National Health Services Directory obviously is our biggest business partner, because if the information is not correct, that's where everything goes wrong. Pathology bookings go, pathology results go into the abyss. Patients can't access. So patients can access the NHSD and see what services you provide. If they pick your suburb, they'll see, your clinic and what you provide and who your doctors are and their specialties. So it's a really good, almost a free advertising. Online booking systems, that information is pushed out to your online bookings when new providers start at your business or when you have a change in providers or provider leaves. Funders such as Medicare. So Medicare, obviously, when we get new, and I'll talk about that in a moment, but, the changeover from GPs coming and going in our practice is sometimes high. And who keeps everyone up to date? Usually me, the practice manager, and we're all human. I'm going to forget someone. So I'm going to forget updating someone, and we're going to find either a delay or no information gets forwarded about those practitioners' patients. So Medicare, private insurers, and then your workplace and accident insurers. So in Victoria, it's WorkCover and TAC. Obviously, it would be different in New South Wales. Primary health networks. How are they going to know what services you're offering and what practitioners you are if we don't update them? So something we often forget about, and all of the primary health networks within Australia have partnered with Provider Connect. So they are all a business partner. So they can, they can partner with us or we can partner with them. And then you've got your communication services such as our secure messaging services and our prescription exchange, which are obviously vital to us functioning in our daily activities, diagnostic services, and of course, public and private hospitals. So that's just a bit of an overview. And the red tape challenge, of course, is who notifies all these people when we get new doctors or when we lose doctors or when we get a new service to our business? How do we notify that, that huge range of people that we work with on a daily basis without having to manually notify each and every one of them? And this is the beauty of Provider Connect. Again, if you're visual, this is going to help you to, follow the pathway through. On the left-hand side, we have our healthcare providers. So GPs, allied health, pharmacies, specialists, we're sort of the first group. And then in the middle, we have Provider Connect. So this is where we send our delivery, or we update all our information in the Provider Connect portal. And it is then pushed out after a verification process, of course, pushed out to all our business partners. And our business partners are listed on the right. And I have given you a rough idea. And remember, we can control who they are pushed out to. So there are two ways of doing it. You can either log into the portal and do the updates yourself, or you can incorporate it in your clinical software, which is available now. And I won't go into too much technical, but I'm sure the digital health team will be able to help you with that. When you log into your portal, that's basically what you see. You can manage your business site services and your GPs. You can look at importing your existing services into the NHSD, which would have been great when we had to do the bulk billing incentive information. We had to register with the NHSD, so that would have been a valuable resource to us back then. You can set up new locations. You can publish things, who you're going to publish your changes to. You can register your practitioners, your business, or any key contacts. So that's just a bit of a little screenshot, of what types of things we can do through Provider Connect. Now, the registration process is a little, I'll be honest, is a little bit clunky. It took me a little bit longer than I would have liked, but I got there in the end. And it has been a great resource for me. So I'm really happy with what I can do with it. So if you're asking yourself why should I register for service for Provider Connect? We need to remember that currently not all providers are registered with Provider Connect. And for this initiative to truly show its benefits, it's going to be a lengthy transition. So currently there are around 45, I think, business partners registered with Provide Connect, and that was of January 2026. So we've still got a long way to go for engaging services so that we can effectively talk to each other. So if you register, you're one more feather in the cap to get that open communication happening. And the biggest issue, I guess, for me is incorrect practice details. So where, a patient presents to hospital and says, I go to Gisborne Medical Centre, but the provider, they can't find Gisborne Medical Centre, so they just send it out into the abyss and keep their fingers crossed that it actually ends up where it's supposed to be. So we often are chasing discharge summaries from hospitals, or patients don't remember their GP's name, or they see lots of different GPs and they don't really know which one they want the information sent to. And I'm sure I'm resonating with you on all those facts. So delayed pathology results, again, if they are delayed, we could look at if our details have not been updated with Provider Connect. Yes, if you've got pathology on site at your practice, of course, your information is going to be to be a quick turnaround, but not all patients are going to get those pathology done at your practice. They may be in Sydney, or they may be in Queensland or Western Australia. So using different providers is going to ensure that pathology results will come back to you in a timely manner if you have your details correct. It will prevent failed delivery of referrals. I'm going to talk about that shortly. And as I just mentioned, misrouted discharge summaries. So going to a GP who left your practice 2 years ago, or going to a GP, a current GP that worked somewhere else 6 months ago and it's gone to their old address. So keeping those things in mind. It's going to prevent risks around medication, as we talked about before. And of course, it's going to stop those frustrated patients who said, I've had the blood test, why can't you access them? The benefits to that is they can access it themselves. So if patients are concerned about something or they need blood tests to take to a specialist, they can access the My Health record and get them themselves. So how great is that going to be? So integrating into your general work. So looking at how we're going to integrate this into our everyday. So obviously, integrating it's going to reduce administrative burden. There's a big lens on that. So as I said, as a practice manager, when doctors come and go, I have got so many forms to fill out and different providers to notify, pathology, radiology, Medicare, and all the government departments, National Health Services Direct, my online booking system. So I'm constantly updating information. It's really time consuming. I would much prefer to be doing something that, is a benefit to my business. So by having myself registered, I only have to do it once. I log in, I update the details, I add a new practitioner, I remove an old practitioner, I add a new service, and it gets pushed out to everyone. So everyone is aware of what's going on. So that to me is a really big plus for this program. I did say it before and I'll say it again, you can choose what information is pushed out. So it is completely up to you who you provide the information to. So remember that. And often this setup process does become for the practice manager or your business manager to initially set up. Once it's set up, very easy. Once you're registered, your GP, and as I said, when a GP starts, leaves, or changes location, one push of the button and all our providers or our business partners are all updated. Changes to hours. Now, that's another significant thing. If you have to change your hours at short notice, by notifying that directly, it's published on National Health Service Direct, and all that information is published promptly to the bigger picture. Or it might be that you change your hours permanently. You might extend your hours. So letting patients know, hey, I'm available after hours now. We were closing at 5, we're now closing at 7. These kind of updates automatically will propagate to your connected partners, and you no longer have to send multiple faxes or emails or fill out a zillion forms, which is really something I'm not my favorite thing to do. Now, referrals not having accurate and up-to-date destination details. So again, if you're sending, this is another frustrating thing and very time-consuming. If you are sending a referral electronically through your clinical software and relying on your address book as the point of contact, what's to say there's so many times we get calls from patients, the person you referred me to didn't get my referral. So we're duplicating things, it's adding more work to us. And we do the same thing and we resend it and it's still the wrong address. So what's notifying us? Where are we getting our information from? So these kind of, having that connection to your secure messaging endpoints is going to help you. It's going to give your current information to all those other providers, and give you current information to all the providers that you use. So that alone to me is a fantastic incentive to get on board with this. So, and things like wrong practice details or missing provider numbers, because as you know, most of our things within Medicare are linked to our provider numbers. So how does PCA support that? It basically gives you that single source, as I said before, that single source of truth of your practice and all of your details, which will automatically update your participating pathology imaging and hospital systems, which ensures that your endpoint secure messaging is current and validated, which will reduce the amount of rejected or bounce referrals. And if you are getting bounce referrals, how do you even know? If you're sending them electronically, who's keeping track of, do they get kicked back? So another thing to think about, I guess. So access to a centralized data means that you have got a up-to-date clinician locator. So again, if it's someone that you don't work with, it could be a specialist that the patient wants to be referred to, and you don't know who they are. You've got access to the National Health Services directory to actually assist you in that process. And that's another whole conversation, isn't it, around electronic referrals and how we can make the most of that, ensuring that our referrals get to the right person in a timely manner. Secure messaging we use for referrals, specialists send their letters to us. We get discharge summaries, we get allied health communication. If you're still receiving a lot of this by fax, it means your details aren't up to date because, a lot of these organizations are already using PCA or Provider Connect or using digital platforms. And if you're not getting them, we need to perhaps look at our systems and our information. Is it up to date? Because by registering with Provider Connect, we can reduce the issues around the failure of messages to either be sent or to be received when we need them. So Provider Connect will help you by maintaining your current endpoints, ensuring that, practitioners who were at the address, they may have updated their address or they may have changed their location or they may have added a new provider. All that information is pushed out across your business partners, which reduces duplicity in the directory. So you're not having to manually change that or update it. And if you, for example, have tried to update your details on the NHSD, it can be quite time consuming. So this is going to improve interoperability. So all that information is automatically going to happen, saving us as practice managers, and I speak for myself, lots and lots of time. So really worth getting onto. I talked about the alternate option of having your practice management software push that information out. So if your practice management software supports PCA integration, which is via the FHIR app, which you will see, or FHIR API in your best practice under your configuration, whether you have FHIR activated or speak to your IT people, this information can be automatically pushed out. So for example, when you update provider roles in your staff list, so, you get new doctors or you get a new allied health, this information can be pushed out. Now, I'm a little bit wary of that to start with. I think I like, being the control freak that I am, I like to make sure that I'm doing it myself and that it's ticked all the boxes. So keep that in mind. If you do it electronically through your practice manager software, um, be aware that there is limitations to what's pushed out. So I think if you're going to start the process, let's start off with the portal and work our way to up to that integration with our software because valuable. This would be valuable. I'm a large organization. I have 24 GPs, lots of allied health, lots of specialists. So this might be work for me, but if I wasn't so ACD, I probably would give it a go. But option if that's something that you'd prefer to do versus having to log into a portal. We talked about pathology, so a better and faster access initiative obviously is going to link with Provider Connect. So, if our details are inaccurate, not so much within our regular pathology provider, but those providers that we may not use regularly, who will use the National Health Services Directory or patient information to send information to you, can result in, results being sent to an old practice location. I still see that. I still see results come through for GPs who are no longer working here, and they are referring them from a clinic, an hour away, but those results are coming to me because the new practice hasn't updated those practitioners' details. So, and I'm sure that's happened to you in the past, and you've had to chase results or manually update your those pathology companies. So it can result in missed, delayed reports or fragmented delivery, which we don't want. We want to be able to move things through really quickly and ensure that our patients, we can access things. But don't forget, the My Health record is going to give you those things anyway. So PCA strengthens result delivery by ensuring those pathology providers have correct identifiers. So remember, it's a digital system, so your health identifiers are where it will be matched against. It keeps secure messaging, the routing of those messages accurate, and ensures safer care, continuity of care for our patients, with the reducing the risks of missed results, which would be, oh my gosh, that couldn't think of anything worse than having an abnormal result that we miss, more reliable electronic, and of course that alignment with the standards that I talked about before with accreditation. So broader workflow improves the broader workflow for me and your practice managers, for any of those who are here today. And of course, that whole efficiency and business continuity. Once you've updated it, it's done. There's no more manual forms to fill out. And if you're connected with Provider Connect, I do believe that when you go to fill online forms, it will automatically populate information. So filling out a form through Provider Connect automatically populates information. So you're not having to look up provider numbers and all those kind of things. So, and if you're a practice manager, you know exactly what I'm talking about. Accreditation standards state that we are to be compliant. We need to ensure that we have accurate information, that we use secure communication systems, and that we have a process in place for the safe management of our results. So ticks all the boxes, doesn't it? So if you are to register, you're going to get a big tick because you've already taken active steps to ensure that your practice is doing all those things. So I do want to leave some time for questions. So basically the key takeaways from today: Provider Connect Australia is not a clinical system. It's a provider exchange platform where information is shared between practitioners and their business partners to ensure that your changes reflect across the whole healthcare ecosystem. It integrates into workflow, meaning that, once you update once, distribute everywhere, lowering the burden on your admin staff and improving the integrity of our data. It strengthens relationships and acts as a trusted central source of provider information, reducing those things we've talked about before, reduction of referrals, improves secure messaging reliability, and of course that safe and timely delivery of our pathology results. So as you can see, there's lots and lots of benefits from it. I'm going to now I do have the last page has got some great resources for you. In fact, and even the very bottom one has got a link to a really good short video that basically sums it all up to allow you to see how it looks. So please use these resources to further improve your knowledge if I haven't given you everything that you need today. So, Janvia, do we have any questions?
There was a couple there earlier in your presentation, but I think I answered them, hopefully to their satisfaction. I don't know if you want to add, so I'll just read them out. What about patients who are not registered in My Health Records? I suppose this is when, what happens with the upload and things like
And I
that.
think if I didn't touch on that, I'm sorry, I should have. So yes, if a patient does not have a My Health record, they are classed as what's called an exception or an exemption, but you need to retain the evidence for 2 years. So you'll need to retain those results for 2 years, where there's a potential to upload them later if they register for My Health record. So, but yes, that is one of the exemptions to the required upload. And I guess it becomes then back to us as a practice or a GP to try and engage your patients on the benefits of My Health record so that they can take charge of their health information. I often like to tell my GPs, encourage your patients by saying to them, it's going to give you access and it's going to empower you to make really informed decisions about your health. So, most patients have a My Health record. I agree, there are some who don't, but often when they're explained what it is, they are more likely to activate that than if they're not explained what it is.
Thank you. And there was a second one. What do we do if a patient doesn't consent to the My Shared Health Record?
Yeah, I think I did answer that, but we basically, if the patient says no, we don't, we tick that box, do not upload to My Health record because there is that box on the pathology form. If you tick that, the results will not be uploaded, but you must tick it because as of July 2026, it's basically going to be that they have to. So pathology companies have to upload to meet the sharing by default legislation that's going to kick in as of the 1st of July. So it is currently being, they're currently onboarding lots of pathology companies are already doing it, but there will be that mandated, you must be doing this. So ticking that box is really important.
That's everything on the chat. Wait,
Oh,
there's the
okay.
Q&A. Can we have the resources display again, please? I'm guessing this is the last
Oh,
slide
yes.
that they're referring to.
The last page.
Yeah.
Yep, there we go. I'll just share that. So there's the resources there. You are going to get a PDF of this, so you will have the list of all the resources. So you'll get a full PDF of every slide that I have given you today. And I find these resources are the most up-to-date, really, I guess, really comprehensive to give you that better understanding of exactly what it is and how it works, and more, I guess, that more deep dive into the registration process. So how you actually register yourself for the Provider Connect, because I wanted today to be more about engaging you in the process. And then the actual process itself is really straightforward. As I said, the digital health team at the PHN will be a great resource for you to touch base with to assist you. But there's lots of help. The digital health website has got lots of resources, and need help, it's got a button that says if you need help, you click that box and that directs you to all that you need to know to get it going.
There's one that just came in. To whom PCA belong? Is it private or government?
It's a digital health agency, so it's government. So, and there's very strict, I did look at that, there is very strict privacy and confidentiality guidelines. So, we are well aware of the amount of hacking and things that have been going on over the last few years. So yes, we want to make sure that the information we're sharing is protected. But remember that the information you're going to share with your business partners is readily available anyway. You're not going to share doctors' home phone numbers or doctor's date of birth. You're going to share information with your business partners that is purely business related and is actually available in the public eye anyway. So you're not going to be, so there's no, I guess, don't be concerned about breach of information because there's not going to be as far as Provider Connect goes, because you actually have to log in through Proda and use your two-factor identification. So the risks are very minimal, and there's a lot of work gone into the back end of security of this.
That's it. I think we're clear in terms of Q&A. Just checking. Yeah, in the other chat as well. There's no. So
Well, I really hope that you got something out of today, that it's made the whole process clearer for you. Working in general practice, I get it. I understand the challenges we face daily. And I think, using this is certainly going to be a way of one less thing to do to ensure that your data is kept accurate, because that is really the way our business is found. If we have accurate information, more and more people are going to start connecting with your business, and your business is going to grow because your services are going to be put out there so that everyone's going to know what you do and that your clinic does all these amazing services. But how do they know?
awesome. Wow, we're keeping well timed, Wendy,
Thank
12:59.
you. Well,
Thank you, Wendy, for again another information-packed webinar, and thanks to everyone for attending. Hopefully, we didn't impinge too much on your lunch. Thank you, and hope to see you in our future webinars. Thanks,
thanks
everyone.
everyone. Have a good day.